Okay, hi guys, good morning, good afternoon, good evening, wherever you are. I hope this video doesn't lag too much. I had problems with previous ones and I tried to solve it, so let's see how it goes. If it doesn't work, I'll just have to make PowerPoints again. Um, so, today I really wanted to talk about the differences in terminology and how people use terminology, especially to do with common mental health issues. They use it interchangeably and things don't mean the same. Firstly, my name is Dr. Stones. My name is Angie Stones, and I'm a psychologist, or more precise, psychophysiologist. And currently, I mainly work as chair of PhD dissertations. I have a small clinic, but really my main work is academic. My first specialty is panic disorder, so I'm going to talk to you about anxiety disorders in general. Let's begin. So, first of all, as we know today, how many times do you hear everywhere, oh, I was crossing the road and there was this big truck coming at me and I couldn't run and I was really feeling anxious and so on. And I have anxiety. So, when people use that word, I have anxiety, everybody had anxiety, my grandmother, my mother, her grandmother, everybody. We have anxiety. Anxiety is a normal thing. We all have anxiety. However, today, it seems that as soon as people have some anxiety about the exams, about something, they go to the doctor and they're diagnosed with anxiety disorder. The anxiety disorder has a specific diagnosis. However, now because of the internet and so on, everybody can look up what diagnosis this is, and everybody can find some of those components in their own feelings, particularly on the internet. People will say, okay, how did you feel? Did you feel your heart pounding? Did you feel lightheaded? Your hands were clumping? You couldn't concentrate, etc. For most part, whenever we have anxiety about anything, we feel this way. And it doesn't mean we have anxiety disorder, but people do tend to be, they tend to say, I have anxiety disorder. Personally, I think that's overused. However, it doesn't mean that this is not a problem. Nobody should suffer, even if they don't have a clinically diagnosed anxiety or anxiety disorder. Times have changed, and maybe we are a little bit spoiled. Maybe our threshold of anxiety has changed. But I would like to explain to you something. The response of the nervous system is the same, whether you are anxious good or whether you're anxious bad. For example, if you're in love, you see somebody that you really like very much, your heart beats faster, your hands are clumping, and so on. But you don't say, I've got anxiety disorder. You're happy to see this person, then you're running towards each other, and you're so happy to see each other. And your body is just excited, and the nervous system is in overdrive. You're lightheaded, all this stuff. However, when negative anxiety comes up, your exam is approaching, or you fear some event, you have the same responses. However, your head is interpreting those responses as a negative event. And of course, if you're scared of something, it is a negative event. And that's why today we have a cognitive behavioral therapies where you relearn to understand that the responses of your body are not going to, they're not different to what you experience when you have positive kind of anxiety. If you can say that, positive anxiety, okay, positive excitement of the nervous system. If people need the medication for temporary anxiety, fine, but to actually all the time say, I'm anxious, you will be anxious throughout the day. Throughout the day. we are anxious about something. Whether it is not catching a bus, whether it is because our car has a problem, whether it is because our teenage children are driving us crazy, whether maybe because our babies are crying all night, maybe our husband just didn't come back from work on time and we are sitting at home waiting for dinner, maybe it's because our hair just doesn't look good today, and we have very important event. Maybe because we were dieting for 3 months and we see only minimal results. Maybe because we have a lot of financial issues and we're just stuck and don't know what to do. So anxiety throughout the day, throughout the week, throughout the month, we always have anxiety. The difference is when that anxiety becomes an everyday event in such a way that we cannot function anymore. So we wake up in the morning and we have that anxiety that is kind of overriding everything else in our day. So even if a nice thing happens, in the background, on the back of our minds, we are anxious about something. It's not the same as worrying. Again, anxiety, worrying, stress, panic, these are all different things. Today, I'm just talking about anxiety. So, remember that anxiety is an overreaction of our nervous system, depends to what level it is. If it becomes daily event, so that it overrides everything nice in your life, that it stops you not for 1 day but 1, 2, 3 days of doing functioning normally, stops you of doing things that you used to be doing without any issues before, stops you of going to work, stops you of looking after your children, stops you of looking after yourself for a certain period of time. I can't say what period of time because it is individual. It all depends what your normal is. Our normal is different. So first we would have to establish the baseline for normal and then we can discuss other things. But generally speaking, if anxiety becomes a daily event which actually prevents you of doing things that you used to be doing before, then yes, you need some pharmacology help. Maybe after a couple of days or a week of pharmacology help, this goes off because the trigger of that anxiety may have disappeared, or you realized, because your mind has calmed down, you realized that you can do it, you can cope with it, and that's all fine. But it may not. So in which case you will have to go and talk to somebody about it and take up cognitive behavioral therapy perhaps in addition to your medication. You may have started with your cognitive behavioral therapy, it's not working as well as it should. You have too many things going on in your life, and basically you need some pharmacology help. Okay, fine. Don't feel a failure if you can't cope. Get any help you can. On the other hand, don't overreact of any small sign of anxiety, because then we lose sight of what life is, that life has anxiety in it. We are going to feel anxiety about something. Anxiety is not a bad thing. It's only a bad thing if it overtakes our lives. So, things that you hear daily on internet, on the TV. For example, there is an advert I just heard recently which actually prompted me to give this talk. There's an advert about not sleeping, so they were promoting this My Pillow, which I would like to have. Yes. So this lady was saying, and I couldn't sleep, and I had anxiety, and I don't know what. This word anxiety is used so easily. You had sleep, you had anxiety. Well, you didn't have anxiety because you couldn't sleep. You had anxiety because you were thinking about not sleeping. So these are two different things. We need to learn how to scale those expressions. Okay, so anxiety produces the same nervous system responses, whether it's positive or a negative. Negative anxiety is not good if it lasts for too long, and we need to recognize this by knowing what is our normal. And I hope that this was useful. I'm going to talk to you tomorrow about stress. Okay? So if it is useful, please let me know, subscribe, give me a comment, and then come back tomorrow. Thank you. I'm not going to have any anxiety. And the video seems not to be lagging that bad. Thank you so much for listening.